So welcome to our chronic pain and medical marijuana webinar today. We're broadcasting from Florida. You can see we have some nice weather. I'm using my patio as a background to kind of, just to say, get in a better mood with the quarantines going on right now. I want to mention that we brought this webinar series on board to basically help people understand how medical marijuana can help their various lifestyle medical conditions. I suffer from chronic pain, and so it's something that's near and dear to my heart. But I think a lot of us take this very seriously. This isn't a game. It's something that's very important to all of us. And so I say that because what we're going to be talking about today is we're going to give you some information about chronic pain, what it is, how medical marijuana can help you, and then we're going to open it up for questions and also for answers. We're not going to go through a lot of slideware, although we do have a few important slides and videos. We thought that would be important from an educational standpoint to help you understand what your condition is, what medical marijuana can do, and what the experts are saying. I have with me today a lady that I've been working with, and I have a lot of respect for. Her name is Alyssa Quintana. I'll have her on in just a minute. Alyssa has done a tremendous amount of research, not only in the chronic pain, but also into other lifestyle medical conditions. There's a lot of people that say they know this subject matter. There's a lot of people that will go out and tell you that they've got the answer. We're not saying that we have the answer today, but we've got a lot of research that's been done. And I don't know anybody besides the program that I work with that has really researched this area of chronic pain as much as Alyssa does. And so at the end of the presentation, she's also going to give us a number of resources which you'll be able to get in an email to be able to access, so you can see videos and also research information that's out there. What I would like to do is I would like to share a screen with you for a second. More importantly, what I'd like to do is be able to talk to you about this whole chronic pain area that right now.
There we go. You got it.
So that we got it?
Nice.
Okay, good. All right. So what we're talking about today is medical cannabis. And what more importantly, I think the purpose of what we're doing is to really create something that is safe, supportive, and judgment-free with respect to medical cannabis. I think there's a lot of just say history that goes into medical cannabis, and we're trying to overcome and not to debunk a lot of the myths that are out there. I think it's always important to point out that whatever you're doing, please consult a physician. I think it's important that your physician is part of this. And if you have a medical cannabis, or you have a physician that doesn't embrace medical cannabis, my counsel is go get one that does. I think a lot of pain doctors today are embracing medical cannabis, but I think it's important that they're also part of the equation so that you're making sure you get the best possible care that's out there. And then also, the other thing is we're all in this together. This isn't a matter of who's right and who's wrong. It's a matter of, in my particular case, I have a problem and I want it addressed. And that's what we're trying to do today, is being able to do all of that. So what I'd like to do initially is there's a video done by Sanjay Gupta, which I think is important. And I'm going to play this video because I think it's important to see what he has to say on the subject. Go back.
Scientists know the most about are THC, which is the psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive chemical. We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
With opiates, you're talking about killing the pain, masking the pain, you're done.
Dr. Julie Holland edited the Pot Book, a complete guide to cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. But cannabis works on two receptors, one that blocks that pain and one that decreases inflammation. It's ironic that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, two plants and natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies.
So Sanjay was basically pointing out that we have research that shows that cannabis is really much better than a lot of the opioids that are out there. But in fact, obviously, because of the situation we've been working under in the last 50 years, it's not necessarily known what it can do. Now, when we come to pain itself, Alyssa, why don't you describe a little bit about different types of pain and what it can do, what it's doing?
Yeah, absolutely. So there are various types of pain, and it's very important to understand the various types so that you can better communicate that with your physician. The first one is somatic, which relates to our muscles. An example of this would be arthritis or maybe even post-surgical pain. Another one is visceral pain. This relates to our organs. This is more of a deep, tender, squeezing feeling. An example of that could be menstrual cramps or even gallstones. And then the last one, the more important one, is neuropathic pain. This can be the most persistent pain, and this can also be the most resistant to multiple therapies. An example of that would be pain related to cancer or even neuropathy. The important thing about somatic pain and visceral pain is that they can oftentimes be confused for one another. It's, like we said, it's difficult to understand those different types of internal pains. And because it's difficult to understand it, it's difficult to communicate that as well. The important thing about pain, though, is that it's subjective. What I may think is a level 10 may not necessarily be the same for you, Mark, vice versa. It's important to know yourself, and it's important to know the type of pain we're experiencing.
I think one of the questions that comes up is, when you have pain, what kind of research has been done on this subject?
Oh, this neuropathic pain, which is why I said one is one of the most important pains, is actually the most widely studied symptoms of the use of medical cannabis. There's actually been over 40 randomized controlled studies with over 2,500 patients with neuropathic pain conditions that have been published, showing overall positive results. And you can see we have a few here listed dating back to 1999 up until 2017. And we can tell you there's been a bunch more since then. But beyond the anti-inflammatory properties, the analgesia and the potential to reduce the use of opioids, cannabis can reduce spasms. It diminishes anxieties often associated with the anticipation of pain. It induces restful sleep. It can gently elevate your mood. These are all essential elements to healing. This is basically what all of these studies have come down to say.
So it's interesting that we've had a lot of studies be done, probably over, there's been over 50 studies in the National Institute of Health database about how effective this is with respect to cannabis and opioids. I should point out that a lot of these are done outside the United States. Is that right?
Yes.
Yeah, these studies. Okay. So one of the things that comes up is, how does this work? In other words, how does cannabis help relieve pain? And so I think what you find is in your body you have CBD receptors. You see, you have the light blue ones here are the ones that are what they call TH1, THC receptors, and the darker ones are CB2 receptors. These receptors are in your body, and what the endocannabinoid system does is it regulates your body. Your endocannabinoid system regulates your pain, your memory, your appetite, your inflammation. There's a lot of things that are there that it basically says you have a problem, and what it does is it uses a mechanism within your body to relieve that pain. Now, what's interesting is most of the CB1 receptors that you see are in the brain and the central nervous system. Most of the CB2 receptors that you see are normally in your organs and associated with your immune system. So this is something that in your body regulates itself. It's very, very important that we understand this is in every person, and it's something that's part of just being a human being. Mm-hmm. It's how your body takes care of itself.
Mm-hmm.
Okay. Now, I have a video I'd like to play because one of the questions people always ask me, how exactly does it work? And I think this video is important to show you exactly how it works. It's a little long and it might be a little technical, but this really gets to the heart of the matter of how medical cannabis can help you with your pain. Sorry about that. Hold on.
Hey, Marc,
Are
a
you
lot of people can't
having trouble
hear.
with audio?
Yes.
Okay, let me just check something here. Is this better?
We are allowing
There we go.
endocannabinoids to do their job better, and we are allowing anandamide to come into fruition, and we create
We
more
can hear it, but we can't see it now.
Okay.
very
I'll turn this off for a second and I'm gonna turn it back on for a second.
All right.
Okay. And I apologize for not being able to hear it. But
What this means is by reducing the cytokine activity of these things, we are allowing endocannabinoids to do their job better. What this means is by reducing the cytokine activity of these two things, we are allowing endocannabinoids to do their job better, and we are allowing anandamide to come into fruition and create more of it. And if you don't know anandamide, it is very much so responsible for creating bliss within the body, reducing inflammation in the joints, but also reducing inflammation in the brain. It truly is known as the bliss product of the body, because that's the sensation that best describes what anandamide does. But in knowing that, we have to wonder, well, how exactly does it do that? Well, because it holds the key to be able to turn off nuclear factor kappa B, or at least greatly reduce it. Nuclear factor kappa B is one of the most widely researched inflammatory substances within the body. It is basically the master control switch when it comes down to inflammation. If we can reduce nuclear factor kappa B, we can reduce the actual DNA result of inflammation within our body. See, if nuclear factor kappa B is always elevated, it can change our DNA to be used to having high amounts of inflammation. So really, anandamide is one of the keys to actually getting rid of this problem where our bodies are getting so accustomed to inflammation that we're just adapting to become these inflamed creatures. So it truly is allowing our body to turn off that master switch when it comes down to inflammation. And mind you, it is doing this all without ever activating CBD1 or CBD2 receptors in the body. I will say that again. It does not affect CBD1 or CBD2 receptors in the body. A lot of marketing collateral out there will tell you that CBD oil does directly affect one of the CBD receptors. It's not the case at all. All CBD oils do the same thing. They naturally increase the production of our pre-existing
I don't know if you had a chance to see that or not. This piece over here. But what I want to do is I'm going to go back and I'm going to talk about something. Excuse me. Let me go over here. But let me kind of summarize what he's really telling you. What he's really trying to point out is we have endocannabinoids in our system that are derived by the brain. And those endocannabinoid systems, what they're able to do is they are able to then turn around and produce and work with cannabis, which is entering your body through a plant-derived product. And what those are done is those are stored in the fatty acids. What those fatty acids do is they're triggered by your neurons. Those neurons then break those fatty acids down into long-chain fatty acids, and that breaks down into a body that shows and produces the endocannabinoids, and your body then sends to various parts of your body, your brain then sends to various parts of your body the endocannabinoids that you need to be able to heal yourself. So I think that's something that I think is fairly important to understand that we ourselves produce our cannabis, we produce our own medicines, and what we're doing is we're usually letting cannabis help our bodies heal itself. And I don't know if that helps or doesn't help understand how this thing works.
Yeah, and we rarely got to hear him talk about anandamides, but that's what you were saying, that's already derived within us. This is a natural substance within our bodies that not a lot of people know about. Anandamides actually assist cannabinoids distribute throughout our entire body. That's why this is so important, and it plays such a key role in pain.
Yeah, and it's important that we understand that. I think that a lot of people think that if we take CB1 or CB2, we take products, THC or CBD, it goes directly into our receptors. It doesn't. Our brain is the one who regulates that and basically regulates where we need to have the medicine provided. And that's why we have the entourage effect, where you may take cannabis for one thing, and it not only helps with that, but it helps something else. You may take it for pain, and it gets rid of your glaucoma.
Mm-hmm.
Type of thing. Now, you want to talk about this? We have different kinds of cannabis that are out there.
Yeah, absolutely. So a lot of patients are very familiar with these two forms of cannabis, sativa and indica. Oftentimes, sativa is more utilized throughout the day. It gives you more of an uplifting cerebral effect. Whereas indica, it's going to be, I like patients, they say it gives you an indica couch feeling, very relaxing, ideal for nighttime. This is a great starting point to kind of navigate what would be best for your medical condition. However, there are a couple of other factors that you need to consider when you're using this medicinally. And help me out, Mark, here with my little slides. Perfect. You need to consider cannabinoids, terpenes, and your biology. So this is how experienced you are with medical cannabis. That's a very important question. How susceptible you are to certain side effects such as anxiety from THC, and how long you want your effect to last as well. You can go over to the next one.
Now, terpenes play an important role in this, right?
I'm sorry, what was that?
The terpenes play an important role in what type of cannabis you use.
Absolutely. So I think that terpenes is something that goes over a lot of patients' heads. And I get it. I was there at first as well, but this is very important. So you're familiar with essential oils, I'm sure, Mark. Have you used lavender to relax at night, maybe?
Mm-hmm.
Yeah, absolutely. That is an effect of terpenes. This is a plant-derived chemical.
Yeah, I'm going to interrupt for a second, Alyssa. When I first got into medical cannabis, I could not figure out how the people at the dispensaries knew which product to use. I know I went to the doctor. The doctor gave me a recommendation. I went into the dispensary, and there were literally hundreds of products. There's a lot of products that are there. And when I went and talked to the person at the counter, they said, okay, here's the products that'll help you. And my question was, how do you know out of all of this what helps you? And it turns out that the terpene profile plays an important role in determining which type, which brand, and more importantly, which type of cannabis that you're using to address your issue.
Absolutely. So that's one of the first things I try to educate patients on is whenever you go to the dispensary, ask specifically, what is the terpene profile for this? So there are a couple of specific terpenes that are fantastic for pain specifically. One would be linalool. You could ask them, do you have anything with a high count of linalool or even myrcene? Linalool comes from lavender, so it's going to be relaxing. It's a natural muscle relaxant. It's also an anti-inflammatory, it's an anti-anxiety. It helps with a lot of facets. Same with myrcene, it's very relaxing. It's often associated with indica-like feelings. And then last one that's fantastic is beta-carophylline. This has very strong anti-inflammatory properties, and it can actually act, it's the only terpene that can act as a cannabinoid itself. It's actually very fascinating.
What's interesting is the terpenes do a lot to, basically it's 1 and 1 is 3. The cannabinoids plus the terpenes really cause the help that's out there. But yes, I think also that it's something that a lot of people overlook, but it's really the key to making medical cannabis work for you versus using just recreational cannabis.
Absolutely. And just to do a quick shout out for a resource on this is Leafly. They are so great about listing the various terpenes for different strains as well. So if the dispensary rep isn't necessarily knowledgeable about that aspect, you can also look this up on leafly.com.
Cool. Wait a minute. Let me get back into my groove here. So how do I take it? What's your recommendation for being able to use it?
Well, like I said, you got to consider a lot of things. The best bet for any kind of pain would be an oral solution. So this could be a tincture. You could basically anything that you can ingest. The difficulty with this is that it's going to require patience and planning, because as you can see here, the onset usually takes anywhere from 45 minutes to an hour, whereas the duration is going to last you anywhere from 4 to 6 hours. It's going to take a while to take effect, but once it has set its onset, then you're good to go for a couple of hours. The biggest thing with this, just a small disclaimer, a lot of patients have made the mistake of taking a small piece of brownie and then 30 minutes later say, I'm not feeling anything, maybe I should take another. This is when adverse reactions happen. So go low, go slow, take it easy. Please wait at least 45 minutes to an hour before ingesting another piece of that delicious brownie. Another method would be inhalations. This is going to be vaporizers. There's even a nebulizer now, and then smoking the actual plant itself. This is probably the more popular because it has a very fast onset. However, it doesn't last nearly as long. So these two in combination are fantastic for pain. You can take on a capsule, say for example, so that it can last you the majority of the day. While you're waiting for it to take on effect, you can go ahead and use your vaporizer or smoke your flower if you would like for immediate effect. Another method that you can absolutely use, I love topical products as well. They're fantastic. There are creams, there are balms, there are patches now. Move has a 3-day patch. It's crazy what's out there nowadays. So there are a lot of different ways that you can try it. It's not just smoking the actual plant. I know a lot of patients they think that you're just going to smoke a flower. Not necessarily. There are a lot of different routes to this. And this is why it's so important to have a knowledgeable physician with this as well.
Yeah, and I'm a big fan of transdermal patches. I think it's great. You put it on, it stays on from 12 to 72 hours, and you don't have to worry about carrying things around with you, or if you're out, or if you're just walking or things like that. Although I think today, with everybody being quarantined, that's less of a problem, but it does make it a lot easier from the standpoint of dosing in general.
Absolutely.
Now, there's another part of this that's important as well, and it's non-cannabis related. Is that right?
Yes, absolutely. This is just one small facet to your medical journey. Cannabis is definitely not the cure for pain, but it's definitely a viable treatment. You can do this alone, or you can even do this alongside conventional therapies as well. But whole body therapy is essential. We need to think of our minds, our bodies, our spirits. It's all important in order to truly treat any kind of condition.
Yeah, I think it's important to understand that in many cases, a lot of the pain comes from inflammation. And so if you can relieve the inflammation, it's relieving the pain. It's not a matter of just attacking pain. It's a matter of how do you attack it, get the inflammation down so it stays that way. And eating right, resting, it's crazy. I heard something that sleeping is as effective as running in certain cases for your body. I don't know if that's true or not, but
I mean, I prefer sleep, but no, absolutely. That's why it's so important. I mean, so many people talk about the importance of small things like turmeric. It's always research what you're putting into your body, whether it's going to be cannabis, whether it's going to be food. It's all important.
Right. So more importantly, I think we should open this up right now for group discussions. If you have any questions, please type them in. We'd be more than happy to answer any questions you might have. I'm sure that when you tuned into this webinar, you had some questions, or at least you wanted something answered to be able to find out if this will in fact help you. And I think the other thing I'm going to point out while questions are coming in is we have some resources that are going to be coming up. We have a number. We're going to send you a follow-up email, and in that email, you're going to be able to access information about different articles that you saw you saw today. There's going to be some more information about videos and some how-tos, and then also you'll be able to access what they call a patient education brochure. And this is a document you can use yourself to be able to glance through to be able to help plan and do your planning to help get your pain down. So my question is, do you have any open questions from the audience? I think we've answered most of them. Oh, here we are, a couple of them coming in.
If you just take medical THC without CBD, is it still healing? Yes, however, it's important to utilize both of them. THC and CBD work very well together. That is essentially what the entourage effect is. This is going to fully engage your entire endocannabinoid system. So depending on your symptoms, THC, especially if it's pain, THC is important, but it's also important to pair that with some CBD, especially because it is a natural neuroprotectant as well.
Super. I think your other question is, it says, what is the difference between the CBD as you get it to dispensaries and other places?
So actually everything that you can get over the counter, that's going to be derived from hemp. Hemp is very similar to cannabis. They are within the same family. I like to imagine hemp like cannabis's smaller, weaker cousin. It can be effective, but not necessarily effective enough to engage that entire endocannabinoid system.
Well, I think it's important to understand that when you look at CBD itself, the CBD that's in marijuana and the CBD that's in hemp fundamentally is the same product, the same thing. I think the difference is that when you get to the marijuana plant, there are some additional medicinal properties that can be tapped into, and especially if you mix it with THC, which gets you above that 0.03 threshold, which is what derives the hemp product. What you'll find is there are other medical properties that can help you be able to heal. It's something where there's a lot of great hemp products out there, and they do work. I don't want to have people get the impression that they don't. I think the thing is, though, in many cases, when you have chronic pain or when you have pain, you're going to need a THC product to be able to really address it. Is the best way of putting it. I have herniated discs in my back and in my neck, and I found the CBD, hemp-based CBD, is okay, but it doesn't get rid of my pain, and it doesn't really help me on a daily basis. It really doesn't help me conduct my business the way it is. Now, I have to tell you, even though I'm taking marijuana-based products, I'm not high. I'm still able to do my job, and I'm still able to communicate with people. I think that's what makes medical marijuana so interesting, is it does have something that helps you be able to lead a normal life, but also address the pain. I personally, because I have 7 herniated discs, CBD just isn't strong enough to do the job. I need a medical cannabis product. If you had trouble sleeping, if you have some anxiety, maybe certain cases of arthritis, it might be able to help you. But I think medical cannabis will clearly win out of the day when you're trying to address pain.
But do you try to also pair that with some CBD as well?
Pardon?
Do you also
Oh,
try
yes,
to pair
yeah,
that with CBD as well?
that's a good point, Alyssa. So what I do in the morning is I have a CBD product that I take, and I take that for inflammation. That is paired just for the inflammation. And then I have a THC-based cannabis product that I take, and what that does is that addresses the pain. And I use both of those together. And it's something that I'll use it in the morning when I get up. I then use it in the middle of the day, and I use it at the end of the day. Because in my particular case, I have a very severe case of herniated discs. And if I don't use them, my life is miserable. When I do use them, I lead a normal life. And so it's just that simple. But it does come into play. And when you talk about the entourage effect, I think Mary was asking about what's the entourage effect. It's kind of crazy. It's like the entourage effect. If you have a little bit of CBD, THC with the CBD, it's almost like it supercharges it. It's almost like it makes everything much more, I would say, potent. Not stronger, but potent. And
you get the maximized effect.
Pardon?
You get the maximized effect.
Right. And I think that they work together. They play together. They're like teammates that play together and they play off each other. And it really does work when you're putting those two together. The other thing about the entourage effect, and my mother found this out. She was taking medical cannabis to address a cancer problem. And so when she went to the glaucoma doctor, the glaucoma doctor was asking her what she was doing because the glaucoma was gone. So she didn't take it necessarily for glaucoma, but it definitely adjusted to that part of the body. So one of the questions that we're getting is, how do you judge dosing with the syringe and concentrates?
That can be very difficult. I know a lot of times the dispensaries usually say to try to give you the size of a rice grain, and oftentimes that's difficult to kind of squeeze out as well. Honestly, with the concentrated syringes, the best bet would be to make little dots on a sheet, and you can freeze them, or you can even put them into your gum, and then you can ingest it that way. It's very, very hard to squeeze out from the syringes. I think the best bet for the syringes is to use them for cooking or to make your own oils, that kind of thing.
I think the advice that I was given is, if you take a look at it as a grain of rice, that you just take a look, when you squeeze out enough that's about enough as a grain of rice, that's about what you want. But syringe concentrates are hard to be able to just basically, by the nature of the product, to be able to get that out of there. There was one of the questions that came up about the bad side effects from cannabis. And one of the things it says that someone has mentioned here, that he read that the psychedelics effects last forever. I'm not sure that I could say the psychedelic effects last forever. In fact, I doubt that they do. This isn't LSD. LSD lasts forever. Cannabis will be out of your system probably within 24 to 48 hours, if not within 8 hours. So you really don't have a lot of lasting effects. I do know that if people do take a little bit too much cannabis and they do get, they feel the psychoactive effect. Some people have just basically they've drank milk, for example, to help them to relieve a lot of those effects that are out there. But you're not going to have a long-lasting effect. What you're probably going to have is you have to be careful about your dosing. Go low, go slow, and be able to just work your way up to where you'll know when it addresses your pain. And you'll also know when you take too much. Let me put it to you that way. But I know you were mentioning the same person who asked about the side effects says his pain management doctor is practically begging him to try medical cannabis. It's because it does work and it gets you off the opioids. I know that when I had my auto accident that gave me my herniated discs, I took some opioids. The doctor gave them to me, and I was in pain. And I went out and took them. And it took me almost 2 days to get those out of my system. And I could not do anything. I basically I had trouble even sitting on the couch. And I could not work. I could not be a contributing member to my family with them. And that's why I turned to medical cannabis, and it's helped me quite a bit.
Mm-hmm. And to just a side note with that, if you do experience an adverse reaction like that, you take on way too much THC, CBD can quell that. So it's always important to have some kind of CBD on hand. I've had that experience myself where dosing, again, very complicated, and accidentally gave myself a little bit too much. CBD, I had a vaporizer pen, brought it down immediately. So always carry CBD on hand.
Yeah, I know that one of the questions that comes up is, do you take it daily? And the answer is yes. This is not a take a pill that goes away and you stop using it. This is something that you take and that you're going to use on an ongoing basis. It's kind of like a vitamin. I think of it like vitamins, that you take them on a regular basis and it helps your body. You want to be able to build up a little bit of how should I say, a little bit of tolerance in your body to be able to handle it. But I think also you've got to use it every day. If the CBD isn't if the CBD oils or whatever you're taking isn't augmenting or helping your body's not producing enough CBD or enough endocannabinoids, then you'll have a problem. You want to help your body produce enough of the endocannabinoids that are there. And I know as we get older, if we've had injuries, if we had accidents, if we have inflammation, we're going to need to help our bodies just basically heal and get better. Same principle as vitamins. You need to do it on a regular basis.
That's also another reason why it's so important to go low and slow, because you are going to be utilizing this every day. So you don't want to all of a sudden build that tolerance up way too much, because you're going to have to keep building off of that.
Yeah, and I think that one of the questions was, do you use like a little THC and more CBD? The answer is yes. I think the main difference between medical cannabis and recreational cannabis is it leans more towards the side of CBD. Now, I don't want to give you the impression that there's no THC there, because I know in the case of head injuries, PTSD, chronic pain, back injuries like I have, you're going to need some THC to be able to help modulate the pain. But you have enough THC to modulate the pain, but not enough to get you high. And that's what you're truly trying to find, is that balance that's in your body. And I think that's important.
It is a sweet spot, absolutely.
Now, one of the other questions that came up is traveling with CBD, going to a place that's illegal. Medical cannabis in the United States is regulated state by state. We live here in Florida, and it's legal as long as you have a medical marijuana card here in Florida and you're following the guidelines. You're okay. But we're surrounded by states, for example, like Alabama, like Georgia, where it is not legal. And obviously, you don't want to run into problems that when you're there. Technically, you shouldn't be taking it across state borders. That's something that's there. People do, but I don't highly recommend it. I really don't want to get into a near discussion experience with an Alabama policeman, that's for sure. But I think that you can take it with you around Florida. I know that when you travel, you have to be very careful about going to TSA, because once you get in the airport technically is federal space. Now, TSA has come out with documents that say that they're not looking for cannabis, they're not looking for CBD, but if you have it in a bag, it's open, and they see it, they have to do something about it. And so I just say, just be practical about how you're using it. And unfortunately, our legal system right now is not keeping up with the science, is not keeping up with the needs of the people. But I just also don't want to have people go start using this, taking it across borders and getting into problems. There's a balance here that you have to put into place.
Yes.
Okay, one of the questions is, what came up is about, it's something called RSD. I think you really meant RSO for cancer treatments. They were asking is, can RSD help with neuropathic issues? Are you familiar with that, Alyssa? I'm not familiar with that.
I'm not familiar with RSD specifically, but as far as neuropathic issues, anything that you're going to ingest orally is really going to help you out with that pain. A capsule, a tincture. Honestly, the tinctures have been the most popular. Not a lot of people are fans of capsules. That would be your best bet.
Yeah, and I think you're referring to RSO oil, and RSO oil has been very effective in addressing and treating. Not only does it treat cancer, that's what my mother's taking, is RSO oil, and she's actually been using it now for 4 years. And so she was told she had 6 months to live. 4 years later, she's still here. So I'll let her speak for herself. She's either stubborn or it's working, one of the two.
One of the two, we'll take it.
But I think it's something that's there. And it also has helped her with her glaucoma. And she's now a 91-year-old woman. She'll be 92 in August. And she's walking, and we're trying to take her driver's license away. we don't think our eyesight's right where it should be. But I'm just saying it's something that does work and something to take a look at. One person brought up is dosing important? The answer is yes, absolutely. You know, you said from time to time you may need a little more THC. The answer is yes. I know that there are days, especially on days where I go to the garden. You can see I have these little gardens over here, and I'm doing some gardening. I'm doing things around the house, and I may need a little more THC than normal to be able to handle the pain. And then I regulate it. I go slow. Now, fortunately or unfortunately, I've been doing this for 4 years, so I've kind of got the formula down as to what to take and what not to take. But I think it is something that you have to pay attention to, and it's not abnormal to need a little bit more THC to address the pain. CBD by itself will not get rid of your pain. You need to have THC and CBD to be able to do that. So taking a little bit more is not necessarily impractical, especially if you've been very active.
Did you see Kelly's question up here at the top? Taking CBD daily like it's a pill for your heart that keeps it pumping. In a few weeks, will you notice a big difference? When I first started taking CBD, and what I hear from most patients is by the end of week 1, week 2, you will feel a major difference. I'm not sure what you mean, like it's a pill for your heart that keeps it pumping, but yes, it keeps that endocannabinoid system running, absolutely.
I know that in the case of my wife, and in the case of my mechanic, guy who works on my car, they took 3 or 4 days of taking it before they saw the results. But once they saw the results, they were hooked. In other words, my mechanic had trouble sleeping, and once he started getting a full night's rest, that's what he wanted. He hadn't slept in 20 years. He hadn't had a full night's rest in 20 years. And you would have to, you can't pry that bottle out of his fingers now. He takes it everywhere he goes.
And you know what's fascinating is that I hear that a lot. CBD is wake promoting, but if you take it like a supplement every single morning, it will eventually really help you have restful sleep.
Right. And I know it helps a lot with and I do a lot of walking. I'm trying to get walking out on quarantine. I'm trying to get out and walk a little bit. I know that especially the CBD helps with the inflammation, and it helps. But I've got to take it every day. I can't just take it once a week. That won't do the job.
Every day, yes. I hear a lot of patients that say they may have not felt it and they were only taking it every other day. No, it needs to be consistent.
Yeah. I think there was one question that came up about the experience with capsules. You want to answer that, or you want me to answer that?
I myself have not tried the capsules. So you go ahead and answer that question.
What I found is that when talking to doctors, and I've taken capsules a couple times. I'm not a big capsule fan, and mainly because what I found out was when you take the capsule, a lot of people take capsules because they're used to taking capsules. What it does is that goes into your stomach, and your stomach will basically absorb or use up about 20% of the capsule, okay? And then the rest of it obviously goes into your system. If you take it sublingually, meaning you put it right underneath your tongue, that goes right into your bloodstream, goes right into your system. So from a cost-benefit standpoint, a lot of people prefer to use tinctures rather than capsules because it's just financially, it's a lot easier. It's a lot easier it's easier to use, I think, than taking capsules. And I think it's also something that's more effective. It costs you less money. There are people, however, that don't like sublinguals, and capsules are a good way to go. And like I say, they take a little bit longer to work. They take about 10 to 15 minutes longer to work, but they last longer. The capsules last, instead of lasting 4 to 6 hours, they'll last 4 to 8 hours, type of thing. So,
but it seems like Elizabeth has a good practice now, and she says she takes indica 50 milligrams and CBD 15 milligrams, and that seems to help with her neurological pain. And she also takes 10 milligrams of sativa to help elevate mood from the pain, and then 15 milligrams CBD, which helps her inflammation. And she says this makes a really big difference, and that's awesome. It sounds like you've really found your regime.
Right, and that's where using it, you know, look, when we were all kids, we all went out and had a drink, and it took a while for us to figure out our tolerance level in drinking. Cannabis is no different. You got to figure out what works, what doesn't work, what is your tolerance level, that type of thing. And I think that's something that you'll find. But the difference is you're not gonna die. You may get a little high, And one lady was pointing, Kathy was pointing out, I take indica to fall asleep, and it does. In her case, she says it's making her a little bit disoriented, probably because you take a little bit too much.
A little too much, yeah.
Or you have a little bit more, or you have a higher dose of THC in it than you normally would need. You know, you go to a lot of dispensaries, they'll tell you that there's there's 12 to 1, 12 CBD to 1 THC. There's 9 to 1. There's 1 to 4, 1 CBD to 4 THCs. So there's different ratios that are out there, and so you may want to try a couple of different ratios to find out what works best for you.
Absolutely.
Now, one of the questions that came up was, how long does it take for your tolerance to build up? That's a good question. I think again, this is something that every person's body is different.
Exactly.
And so there's no answer for one versus the other, because what works for me doesn't work for my wife. My wife has much higher. My wife is much more susceptible to THC than I am. And on the other side of the coin, CBD works great for her. I think a lot of my problem is more the pain levels than anything else. So I think that within 3 to 4 weeks, you'll get a pretty good idea of what works for you. And I think in that same time frame, you'll start building up some sort of tolerances. So your body gets used to it. Your body gets used to being able to have something that helps it out. Now, the counter to that is every 6 to 8 weeks, I stop taking cannabis for a day. I just stop it. And the reason I do that is because my body gets lazy. My body starts seeing that there's something that's supplementing it, something that's helping it out, and it can get lazy and stop producing enough endocannabinoids on its own. So what I'm trying to do is I'm waking up my endocannabinoid system and saying, gentlemen, just because you're being helped out doesn't mean you can take a vacation. And I find that afterwards, I do feel a little bit better by just taking a day off. Now, in my particular case, I can only do about a day because my pain level goes up. If I'm not taking it, the pain is one where I just don't want to play that game. But I think some people maybe do 1 or 2 days, and you can take a look at what really works for you. But I suggest that you try that. If you're getting a little bit disoriented, just be careful, because sometimes you have to worry about the CBD, the THC level that's in there. That has a lot to do with it. And let's see, this CBD strains seem to work differently. How can one assess it? Mary, I think this goes back to the terpenes that are in it. I think this goes back to what we were talking about earlier. It's not just the cannabinoids that are there. When you go into those various stores and you go to various vendors, they have different terpene profiles. And those terpene profiles all have a different reaction to your body. So I think that CBD is not CBD, not CBD, because there's something else in there that something else is called terpenes. And you got to pay attention to that as well. So when you go to your store, ask them not only about the CBD, but ask them about the terpene profile that's there. I know which terpene profiles my body prefers now. Again, after being at this for 4 years. But I think it's something that you may want to pay attention to, because if you dial that in, I'm telling you, once you dial that in, it makes a huge difference in your life. You know, running around in pain makes you a very grumpy bear. And I know that I prefer not to be a grumpy bear.
Going to finish off that question, another thing to look at would be also the percentage of THC to CBD for each CBD product. I know that, for example, if you go to Move, their ACDC is more like a 2 to 1, but they promote it as a CBD. Whereas if you were to go over to Liberty Health Sciences, their CBD product has 17% THC, so it's more of a 3 to 1 instead of a 2 to 1. So that's something to also take a look at as well.
Yeah, one of the questions that came up, or actually the comments that was made, was Gloria was mentioning that she uses medical marijuana. She's been using it for 2 years to help her sleep, and it works tremendously. But she runs into the problem that when she goes to a dispensary, sometimes it's out of stock. And I think that is an issue. My counsel to you is really have 2, if not 3 dispensaries to get your products from. And look, dispensaries right now, they're like any other business. They're trying to keep up with demand. And especially with this area of this quarantining. I was talking to 2 different dispensary reps today, and we were talking about their inventory levels, and they were saying that they're producing more cannabis than they ever have, and they can't keep up with demand. So I'm just saying that it's a supply and demand issue. It's kind of like not as bad as toilet paper, but It's probably like chicken. Sometimes it's in the store, sometimes it's not. But I think there's something to pay attention to. I have actually, because I work in this industry, I work with almost all the dispensaries. But there are 2 or 3 what I call go-to products that have helped quite a bit. Now, one lady asked, she said she tried something from North Carolina that worked great, but she hasn't found it here in Florida. The one from North Carolina might have been Charlotte's Web. It may have been that product, and I know the VitaCam carries Charlotte's Web. So if you're looking for that, you might want to take a look at it. But that doesn't mean you can't try another CBD product. You'll find there's quality CBD products that are out there that are being put on the market. I know Move just came up with a whole line of CBD products that are great products to take a look at to really go out there. And then Elizabeth mentioned that Amanda Hemp has a 15 milligram CBD product that really helps. Yeah, she doesn't like tinctures, she likes capsules. It's whatever works for you is really important. I think that's what's there. One comment that was made is about vape cartridges, that they've only tried vape cartridges. And I know a lot of people have done that. Vape cartridges are very effective. They work immediately. I carry a vape cartridge with me because with my pain level, especially if I'm walking around or I'm working on something, if I step off a curb, if I tweak back, if I do something, I can take a hit off the vape pen and literally the pain goes away. And I'll be candid with you. When I wake up in the morning, my level of pain is between a 7 and an 8. The first thing I do is take my drops, my tincture drops, and then the second thing I do is take a hit off my vape pen, because literally within 2 minutes the pain goes away, and that's what I'm looking for. But I don't. But the negative of the vape pen is it only lasts for an hour or 2. So you got to basically use it all day long if you're really using it for pain. So I'd look at augmenting it between the tinctures or the capsules and the vape pen to really come up with a regime that really works for you.
And again, even those topicals as well, utilize that. That would really help.
Yeah. Elizabeth was pointing out that she uses the True Leaf Indica 50 milligram capsules and also has the 10. They do work. I mean, they really do work. I think, again, you've got to kind of, a lot of the dispensaries have coupons. And one of the things you're going to get as a follow-up to this is the capability to download a patient education brochure that has coupons in there. You get discounts. Try the different products that are there. Try the different dispensaries that are there. I know that it really makes a big difference that's there. Most of the dispensaries, almost all of them, also deliver, which is great. You don't have to drive across town. You can just get it there. I think Trulieve now has a $15 delivery fee, which I think is great. Saves you probably burn that in gas, time and oil being going down there. So
they asked here, what happens if you were to take it for a while and then just stop? Do you mean you have to get off of it slowly, like opioids? Not at all. I would say whenever you quit your cannabis, your worst reaction is going to be kind of an edgy feeling like you haven't had a cup of coffee. That's honestly going to be about the worst thing. And if you are, I know you said, Marc, that you have a green day where you take a break between THC so you can kind of lower that tolerance. That's why it's important also to include that CBD as well. That'll really help keep the edge off while you're trying to lower your tolerance.
There's no negative. The only thing that happens, for example, and I'll use myself as an example, when I stop taking it, the only thing that happens is my back pain comes back. Okay, there's no withdrawal pains. My hands don't shake. I don't crave it. That's not the issue. The issue is for whatever reason that you're addressing it, it comes back. Now, the thing I will caution you on is if one of the reasons you're taking it has to do with the fact that the pain comes from inflammation. If the inflammation comes back, it may take you a while to get the inflammation back down. Inflammation isn't like a switch you turn on and off. It takes a while for it to come up and it takes a while for it to come back. So I think that's why cannabis, there is a lot of research that's been done on that. And this seminar isn't addressing that, but what we'll probably do is I'll probably send you an email after this with some research that you can take a look at with lupus and cannabis. That's okay. One of the other questions that came up is sativa or indica for pain in hands and feet. And I think this has to do a lot with not only whether, well, you want to address this, Alyssa, you want me to take it?
Up to you. I mean, if we're talking neuropathy, I definitely think that indica would be the best bet, but again, this is also subjective. I don't experience that, so you tell me.
Well, I found that if you're, it's not a matter of indica or sativa. I found that the indicas get you to relax. The sativas make you a little more active. Although I have to tell you, the terpene profiles also do a lot to be able to affect that as well.
Mhm.
I found a product that comes from, that I really like, that comes from Cetera, that's high THC, but the terpene profile lets me sleep at night. And that's been really helpful in the evenings for me, especially when I've been active during the day. So I think that's, again, where you need to talk to your dispensary and find out what's there, and then try and try to do that. One of the other questions is oil or flower. Do you want to talk about that one?
That, again, so subjective. I hear a lot of patients really prefer the flower, and that's mostly because you're going to get the full effect from the flower. The flower is going to have its own natural terpenes already kept preserved. Whereas oils, they extract it. Terpenes can be taken out and taken and put back in as well. So it's all really preference, to be honest.
Yeah, I think it has to do with your particular lifestyle. I prefer, personally, I would prefer the oils because I don't, you know, I just never grew up as a smoker. That's not my thing. Although I will be the first person to tell you, you'll find me with my vape pen, mainly because if I get pain during the day, that's something I do definitely want to take a look at.
And that's the biggest thing, is convenience. Because with the vaporizers, you're not going to have that crazy smell. You can't really take flower around with you.
Right. One of the questions came up is that it says dispensers are saying not to waste your time getting certified in medical cannabis to be able to get a job at their dispensaries. The dispensaries do a really good job of training you about their products. There's just not a lot of good training out there for medical cannabis. I've got 2 certificates in medical cannabis as a practitioner, 2 practitioner certificates. I have to tell you, one of them, the test was, because I've been researching this for 4 years, and I've built an extensive library of research. I mean, I will challenge anybody as far as a library research that's out there. But a lot of times people just haven't spent the time to take a look at it, and the pros and the cons. And I think the other thing is what's real and what's not real. The dispensaries will train you. They do a very good job of training you. But I do think it's important that you know what you're getting involved in. I do think it's important that you spend time looking at the products are, what they can do, what are the side effects, that type of thing. I know that when I first got into this business, started researching it, let's put it that way, before I got into business, I was very upset to find out that we had been lied to for so many years, find out that nobody's ever died from using cannabis. I mean, it's just all these rumors that were just not true. And I felt it was important to get to the bottom of it and see what's there.
And just know that because in the state of Florida, everything is still just a little bit, dispensaries can't really recommend anything. They have gotten in trouble with that in the past. And if you try to get a specific recommendation from you, they will tell you, I'm sorry, you have to go and talk to your physician, which, again, that's very important. When you are asking your dispensary rep questions, make it a little bit more generalized, a little bit more broad. Ask them, you know, what have you experienced with other patients? What do you think is more popular with cancer? What can I get? What do you see? Because they see those people coming in, day out, but they can't give a specific recommendation because they're not a physician.
Yeah, I mean, there's not a medical college in the United States that puts out a degree in cannabis. There are some good programs. I know 3 of them. I'm associated with 2 of them that I think are excellent programs of being able to learn about cannabis to get a cannabis practitioner's license. But however, the one I got certified from took me 2 years of studying, and I had to take 5 tests. It wasn't a piece of cake, let's put it that way, but it was worth going through and finding out about it. But you don't have to have that level of information to be able to get into the cannabis field. This is so new. I use a term from Star Trek. We're going where no one's ever gone before. I mean, everybody was big into their fatties and getting high, now to be able to get cannabis, to be able to live your life and to be able to conduct your life, I think is very, very important.
Mm-hmm. And that's why it's so important to have talks like these as well.
Yeah, somebody made a comment about something called True Powder. I have True Powder and I tried it. And mentioned it doses in 5 milligram forms. The answer is yes, and be very careful about True Powder. Okay, it does help you. It's almost pure, but it's almost pure THC. And so what I'd like you to understand is that it does help a lot, especially with pain. But be very, as they say, be very, very careful. Okay, it's not something I've seen people take it and throw a whole bunch of it into smoothies, and then an hour later you can't talk to them. Just be careful. It's like brownies. Be careful. Okay?
Slow and slow.
Yeah, yeah. There's one last. There's a couple other comments coming in here. There's one here I love. It says, I wish I could have been a hippie in the 1960s. Where can you learn about terpene profiles? I'm going to have up on my website within the next couple of weeks a whole section on terpene profiles. And I would say right now the first place to go to is Cannigma, CANNIGMA.com. Cannigma is from Israel. They've got some great information, and it'll be in the handouts that we send to you. Got some great information about terpenes that's out there. How should I say? It's something that is very important to understand. The same person also mentioned that, by the way, I lived in California in the 60s. I wasn't a hippie, but my roommates were. And I'm not sure they learned anything about medical cannabis, but they sure learned a lot about cannabis in general. It's there. Anyway, so I think we've got most of the questions answered. Very much thank you. Some people have thanked us for the seminar. Well, thank you very much for attending. I hope this has helped. I hope this has helped your understanding cannabis. You will get a follow-up email that should help you tremendously to get you a lot of information that's here. We're not just dumping information out there. We really want to be part of your life to be able to help it get better. We thank you for taking your time, and please tell others about this. This will be placed on a YouTube video. So if you have your friends that want to watch it and that type of thing, they'll be able to see it. And we hope that it's something that'll benefit your life. I mean, I live on a daily basis, and if I can help one person a day, I feel we've got some. So again, thank you very much.
Thank you.